Welcome everyone to TraumaEngaged Schools Resources for the Alaska Healthy Schools Learning Collaborative. This is the first of a 5 to 6 part series. And my co-presenters with me today are Heather Coulehan and Vanessa Shannon. And I'm going to turn it over to Heather for this next slide.
Welcome, everyone. We really are so pleased to be here together in this space to have good conversation. And I just want to acknowledge that for Sharon and I, we are joining you from the land of the Aquan Tlingit people on what we now call Juneau. And we want to say Gunishjish and honor and respect their relationship to this land. And as we're gathering in this space together, I encourage you to think about the people whose land you are on. If we were here together in this space, we'd invite you to write that into the chat box. But hold that in your mind as we have this conversation about trauma-engaged resiliency and relationship-based care, because we know this isn't a new concept or skill set. Really just new educational or research language or a name for a way of being that has been taught for thousands of years. So take the opportunity today to consider the cultural or community values and strengths where you live, and how will you really build on these strengths into your trauma-engaged practice.
Our objectives for this session are understanding the current mental health landscape, thinking about what resources do you need, and then knowing what resources are available in the state and with colleagues and how to access them, and then conversations about implementation of resources. So we're going to take you into Alaska's Education Challenge and remind you that one of the core commitments of the Safety and Wellbeing Group was building on trauma-engaged schools. Alaska schools will create a humble and responsive and safe environment that recognizes the needs of the whole child and institutes trauma-informed practices and understands the vital importance of building all relationships surrounding every child to improve resiliency, health, and academic outcomes.
So I'll just take this moment to talk about collaboration, because all of the resources that we're going to highlight today really were developed by Alaskans for Alaskans. So the Education Challenge really sparked this desire to work together. As this quote from the Transforming Schools Framework says, we know that in that collaboration or that collective impact, that is going to bring even deeper impacts for students and their families. And so I think maybe we didn't even introduce ourselves, but I am from the Association of Alaska School Boards, a small nonprofit that works with school districts across the state. And in developing these resources, I brought to the team all of our membership, our partners, all of the districts and schools that we know is doing this work on the ground. Sharon and Vanessa work for the Department of Education and Early Development. And as they came into this partnership, they brought all of their resources and all of their connections across the state. So even on the team who was coming together to develop these resources, we really brought our perspectives, brought our voices, brought our membership, our stakeholders to the table. And then as the resources were developed, our partners from across the state who are really doing this work reviewed everything, gave input. And so the resources that you're going to see today truly were developed by Alaskans for Alaskans to reflect the strength and the resilience across our state.
I'm going to talk a little bit about mental health in school, Alaska Schools, a landscape assessment. This is something that a group of us that have been meeting for a while thought about talking about what's in schools. A lot of times people will say, well, the schools aren't doing anything for emotional health or mental health, behavioral health. And we thought it would be good to do an environmental scan of what is happening currently in our schools, so we know how we can best meet their needs of what's missing. And the Alaska Mental Health Trust Authority funded this project, and they worked with Stellar Group based here in Juneau to do this environmental scan that we'll talk to you a little bit about. They interviewed 31 of the 54 school districts. Every Alaska public school was invited. Those 31 districts that completed the interviews represented 91% of the students in Alaska. The interviews focused on mental health concerns, foundational elements, mental health supports, impacts and barriers, and ideal systems. There's a summary report that synthesizes all of the key findings. And then there's a profile for each of the 31 districts that were interviewed. And I'm going to turn it over to Vanessa to talk a little bit about the key findings.
Yeah, so the impacts of COVID-19 in schools were pervasive for individuals, districts, and communities, and were discussed in almost all areas of the interview and inquiry. So for individuals, pandemic impacts manifested in the form of issues such as stress, anxiety, and burnout of staff, and observations of increased needs among students that some predicted could continue into the 2021-2022 school year, like we are in now. So isolation, trauma, depression, and anxiety were all examples of pandemic-related impacts. And then the increase in need put pressure on all tiers of supports and services, from delivery of universal supports in that tier 1 to identification for intensive tier 3 issues. Delivery of direct SEL or social emotional learning programs and mental health services were disrupted to varying degrees. Some programs paused completely because of COVID-19, and others just adapted to virtual delivery. So there is variability between districts. Districts are using a range of different approaches and internal and external resources to address student mental health. There are combinations generally by most districts to provide some level of social emotional learning and mental health services, but the levels of services and supports really kind of varied between districts. Districts were asked to outline what their mental health services and supports were in this context of having like that multi-tiered system of support continuum. So most districts have some form of services and supports at all 3 levels of those tiers, with some exceptions. So tier 1 is usually, generally grade level specific and are often curriculum based. And then a smaller number of districts have developed their own programming, typically created by a counselor or related role. Tier 2 supports are available in most districts, though there were gaps that started to emerge at this level. Interventions often take on what was one described as more of a menu of supports available based on available resources and student needs. And then intensive tier 3 supports were really highly variable and really dependent on access to trained district or outside personnel. And then just counseling and service delivery really varied and might initially continue with the district if appropriate staff were available. And then, barriers. Districts of all sizes face barriers to implementing or delivering mental health services. Some of these were just alignment of resources, maybe availability of supports, access and resources, and then obviously external influences. And community partnerships were often really valuable in overcoming some of these challenges too. Next slide. So the role of in-service and professional development, districts often use in-service and professional development opportunities to provide staff training for school climate and mental health priorities. Training topics have included trauma-engaged principles, culturally relevant approaches, and social-emotional learning, among numerous others. Some districts established early release days to offer consistent in-service time, delivery of synchronous and asynchronous content during COVID-19 allowed some trainers to reach more staff members on a regular basis and created more flexible on-demand access to professional development content. But generally, mental health services and supports for staff are addressed typically through professional development and in-service opportunities. And those are focused usually on self-care, staff wellness, as well as through staff health benefit programs. And then community partners. Trained school staff and community partners are really critical to providing mental health supports. Many districts include their staff and community partners as a strength for this work. The relationship building with families and community partners that comes from these efforts is also positive for districts. State, regional, and local community partners play important roles in supplementing services outside of the district scope, such as those tier 3 services. But the relationships range in formality and include contracts or grant partnerships, with the latter providing numerous benefits for districts. So we'll just take a moment here, since we have a small group with us today, just take a moment of reflection and everything we just chatted about. What specifically brought you here to us today, and what do you need as far as trauma-engaged resources for moving forward?
Do you want us like to answer or okay?
Yeah, totally. Yep.
Okay. I guess for me, I've had like the last 6 years a lot of training in trauma informed with Sharon's sister here in South Dakota. And so for me, anytime there is a training, I just like to hear a refresher, and also being here in South Dakota, you know, see how other things go with another state, or something I can learn, you know, from another state to use here in South Dakota.
Thanks for sharing, Carrie.
No problem.
Anyone else? What do you need today, or why are you here today with us? Well, Stephanie says in the chat, just a refresher. Yeah. And Mary says Alaska has a larger indigenous population, which we have in South Dakota.
So I'm just going to refresh our memories of our Transforming Schools, a framework for trauma-engaged practice in Alaska. This is something that all of the symbols that you see on the screen, After School Network, Alaska Mental Health Board, CDVSA, Anchorage Community Mental Health, First Alaskans, and the Association of Alaska School Boards, who has been the main partner in the development of the framework and all of our resources that we're going to be sharing with you, and the new developed resources that we're going to give you a glimpse of as we move forward. On a scale of 1 to 5, you can put it in the chat box. How familiar are you with the Transforming Schools resources? I hope so, Heather. I hope you're a 5. Stephanie's a 2. So something that was released last fall, and I'm going to let Heather talk a little bit about this, is our toolkit.
Thanks, Sharon. I think that we really, in setting the stage with the mental health landscape assessment that we were just hearing about, we really learned about why do we have these Transforming Schools resources. And what we're seeing on the screen right now is sometimes we call them the bubbles or the circle diagram that reminds us of the components, 11 components that are really needed in this mental health landscape we were just hearing about. And I think we also see in this graphic the strengths and the resources we heard in the mental health landscape. So that need for partnership with community and with organizations in the community to really meet the mental health needs of students and staff working together. So this suite of resources in Transforming Schools in the framework, which is a document that really gives background information, gives the research, gives the narrative, gives stories of what does this look like in common practice, what does this look like when it's transformed in a trauma-engaged way. So, and we, as I said, being the voice of partnership and collaboration, this was developed in partnership with districts from across the state. It's strength-based, resilience-based. Sharon and Vanessa always feel free to chime in when I miss something. And I think also, I was thinking when you were saying, Stephanie, about a refresher, and you were saying, Stephanie, kind of just being introduced to these resources, having examples of what does this look like in practice is, I think, what is a real strength of the Transforming Schools suite of resources. Is what does this really look like in practice?
And on the department's trauma webpage, there is also recordings of our toolkit series from last fall. If you want more of a refresher on particular chapters and what was discussed in those hour-long sessions last fall, there's a session for each of the sections of the toolkit, and that's on our trauma page at the department.
Thanks. I think we can go on to that. Great, thanks. So relationships really are the foundation in the development of this suite of resources. And then in each component, the steps in each component, the action steps, the transformation really happens through relationship and happens through real dialogue together. Having that meaningful dialogue about what does learning and education look like in our community. So you'll see that there are many resources in the toolkit. On this slide, it's offering the resource that comes from First Alaskans Institute, one of the partners in developing the framework around hosting community dialogues. So that's a little teaser to entice you to come into the toolkit and see what kinds of resources are in there to build relationships and partnerships in this work. And next slide. So Sharon mentioned the Toolkit Tuesday webinar series. that you can find on the main DEED framework page. And these are worth checking out because in these webinars, it's not just us presenting that you see here today, that we're on the team, the core team that was sort of like herding and shepherding these resources. What you'll find in this webinar series is folks in schools, in districts, talking about what does this work really look like in practice in their work. So I definitely recommend this webinar series to see what this looks like in practice. What does it look like in different places? Mary had said that Alaska has a larger indigenous population than in South Dakota. So what does it look like in Alaska? What does it look like in different parts of Alaska? So you'll find those answers in this webinar series. Next slide. And so Sharon gave a little bit of a teaser of some resources that are still in development, but are next to being done. And in fact, on November 2nd, the session in this track is going to be diving into these 3 new resources. So the Toolkit Milestone guides, you know, people, we all get excited about this work. And then we're like, wait, where do I really start? Or, oh, wow, that was a really big action step that the framework offered. I don't even know how to break that down. And so what we have ready is Toolkit Milestone guides, and schools and districts had requested these as a way to plan forward for what does it look like if we're going forward with this deconstructing trauma component. How do we get started? How do we get ready? How do we start? How do we like implement this? And then how do we reflect on and refine our work? That's what you'll find in the Milestone guide, is that exact progression of what does it look like to put this component into practice, broken down into micro steps, small, bite-sized micro steps. It's all about how do we move from knowing this to actually doing the work. So November 2nd, please join us right here as we dive into how to use Milestone guides. We'll also look at our Knowing to Doing video library. So we spent this summer knocking on the doors, well, virtually knocking on the doors of our district and school partners doing this work, and ask them to record themselves in Zoom to give us a visual, a window into what this looks like in their schools or districts. And so those videos are each less than 7 minutes long. So they're bite-sized. They don't take a long time to watch, and yet they are very informative and interesting. And we ask each presenter to show a photo of where they live in Alaska. So that too is kind of a fun part of the library. Again, November 2nd, join us to find more out about this. And then, of course, we know that communication about this work is really important, and communication on social media so that it's bite-sized again and are bringing people into this work. So we have a social media campaign that we'll also be talking about on November 2nd. And we'll look at the campaign and then point you in the direction where you can actually download the media posts, the social media posts to use at your site. So some upcoming resources on November 2nd. Did I say that often enough? November 2nd. Oh, Sharon, you're on mute.
Sorry about that. Wouldn't be a recording if we didn't talk on mute at least once when we're doing this. Recently, there was a working paper published by the American Institute for Research for the International Organization for Economic Cooperation and Development. And in that paper, they did an in-depth synthesis of existing research on improving educational outcomes for students who have experienced adversity and/or trauma. In their paper, the authors examined Alaska's Transforming Schools framework as one of 5 case studies that explored the role of education sector in promoting the well-being, learning, and positive educational outcomes for children who have experienced adversity and/or trauma. And I'm just going to put this back to all of us in Alaska. This is not something that was created in a silo. This is something that we took to thousands of Alaskans over the course of the 2 years that we were developing it, to reframe, look at what we've done, tell us that, no, we don't need that, we need this, or yes, you're on track with this. And so that was something that was really exciting. And it's looking like our work is paying off with that, as we have gotten several national accolades for our framework, and now we're starting to get some international ones also. And again, if you want copies of the framework for you and all of your staff, I have several thousand in the office ready, willing, and able to mail them out to you. So all you have to do is send me your name and your email and the address to send them to and how many you want, and we will get them in the mail to you. Another set of resources that a lot of you are familiar with are online e-learning trauma courses. Over the summer, we released a new course, and that was on anxiety, overcoming anxiety and stress. I don't see that one listed, but that is our newest course that was out. We have about 12 trauma courses currently. The ones on the right are our micro courses, and those are only 20 to 30 minutes long. And in each of those, you will be able to print off a PDF that looks similar to this, that gives you hands-on tools for you to use with your classroom. Another resource that's out there for you is in our e-classroom, the Navigating Transitions, Promoting Wellness to Prevent Suicide. We have a lesson, about a 45-minute lesson for each grade, 5 through 12, for suicide prevention and suicide awareness. We also have in our e-learning classroom, the Alaska Safe Children's Act, relationships, grades 7 through 12. This is our Breeze Law education curriculum that's been developed. There's 3 bands to this curriculum. There's a lesson for grades 7, 8, one for 9, 10, and one for 11, 12. September, as all of you know, was Suicide Prevention Month. I just want to make everybody aware that these resources are still available for messages of hope. There's banners like you see listed on the screen. There's little cards that you can print out and hand out to students, or put them in their packets or their lunches if you're in virtual learning right now. Just wanting to let you know that those resources are still available.
And AASB brings a number of resources to the table as well, or a number of services to the table as well. We've talked a little bit about TraumaEngaged services, social and emotional learning, school climate. AASB is who partners in the School Climate and Connectedness Survey. We partner with Panorama Education, so we can offer lots of support around school climate, and particularly the SCCS survey. One thing that we can really offer support on is community coordination and dialogues. That component from the framework and the toolkit of co-creation. How do you really engage in dialogue together in a meaningful way? What are the structures for fostering that kind of dialogue? Youth leadership and engagement. We know that that's a really important component of this work, is youth themselves as leaders in the work. And then family school partnerships. We have a resource that again was created in partnership called Stronger Together, which is focused on school family partnerships. So contact us for more information and for support in any of these areas. One way to keep the conversation going is to join the SEL and the TraumaEngaged statewide learning community. It's an online learning community, and it's a partnership with the Alaska Staff Development Network, with AASB, with DEED, and it's hosted in ASDN's ACPlan online platform, which is actually, interestingly, part of the teaching channel. So when you join ACPlan, you get access to teaching channel resources. So it's a great like twofer there. And so there is, in the ACPlan system, they're called teams. The learning communities are called teams. And there's one set up for SEL and trauma-engaged conversations. So there are modules there, 5 modules there. It focuses in on deconstructing trauma, relationships, family partnerships, SEL, and there's one more, relationships, maybe, if I didn't say that. Oh, right, it's right there on the screen. Sorry, self-care is the other one that's there. So it's a great way to get more information. There's a discussion thread there, so you can join the discussion thread. And the way to join it, it's free, and it just requires going to the ASDN website, clicking on the ACPlan graphic, and then that will bring up directions to join. It's a great way to keep the conversation going.
So we'll just take another short few seconds here on what is one of the resources that you'll put into place, and what is your first action? If you want to chat in the box, or just take a few seconds to think about it if you're watching the recording, and think about what one of the resources that you'll put into place.
Here's the next couple of slides just have a few national resources that are out there for you to take a look at and to see if there's something in there that might be of interest to you. This one is the National Child Traumatic Stress Network, Child Trauma Toolkit for Educators. On here, we have the trauma-informed school strategies during COVID and school entry reconsiderations for supporting student social and emotional learning and mental behavioral health amidst COVID, because we are all still in COVID. And I'll let Vanessa talk a little bit about the next one.
Yep, CDC has some great resources for parents, caregivers, and guardians, different ways to cope with COVID-19 still. And then also the positive behavior interventions and supports. That center has some great resources around multi-tiered systems of support while we are coping with COVID-19. And then the National Institute of Mental Health also has great strategies on their website too.
Thank you for joining us today, or joining us whenever you're watching this video. If you would like to reach either one of us, here's our contact information on the screen. And thank you for all of your hard work and what you do every day to support students in Alaska. Again, thank you for your time. We look forward to hearing from you in the future.